if they're standing and they're doing an isometric hold, and if the traps start to get tight and it causes pain in the neck, that's really more of my question. Or if you're side lying and you're holding an isometric, or if you're externally rotating, whatever you're doing, and then resistance goes to the traps, the upper traps, and the neck. Do you stop?
Okay guys, so when I'm doing shoulder elevation, when does the trap start to become more applicable? The higher you go. So what would you do if you're doing tendon toughening or at a lower level isometric? Would you keep it lower or start to go higher?
Lower.
You got it. Keep always. The no pain, no gain theory does not apply to rotator cuff problems. So always below pain threshold. And you don't want to go too high, because then the trap does start to have to help. It has to assist. You know, the glenohumeral joint only has so much motion. Then the shoulder blade has to start to move up with it. But I don't want you guys to worry about that so much anymore. So if you're doing these, if you get someone who comes in who's acute to you, and I'm hoping that you don't have patients that are that acute. You may get patients that are that bad because of changes in the healthcare system. But if you get someone that has a shoulder pain problem that's that bad, you may have to start them adding isometric exercises into their program to toughen the tissue. When you start that movement, you're not going to do it way up here, because the trap's it's going to get hard to hold if you just do it down below. Supraspinatus is working right here even more than it is here. So just start it lower. That'll decrease the stress on the trap. Always below pain threshold. So if you do it here and they start to say, oh, I got some pain in my shoulder here, what's that tendon trying to tell you? I've had patients before that are so severe with supraspinatus tendonitis that this is all they can do. Now, what have I done by bending their elbow and doing this? I just decreased the lever. They couldn't even hold a straight arm. That torque, the longer lever, was too much for the supraspinatus to hold. They had to start with their arm bent and holding isometric contractions, and then slowly they straightened the arm out once the tendon got toughened, and that can take months. You got to educate your clients. They're in it for the long haul. When they start with you guys, it's about education, trust, moving them forward. And what's going to build trust right away with your clients? When you get them out of what? Pain. Yeah. When they're like, holy shit, this guy knows what he's doing. I don't have shoulder pain anymore. I'm going to keep coming to him.